First of all, I must start with saying that COVID testing and treatment is free in Cameroon, and it is based on a strategy dubbed 3T, that is track, test, and treat. But we have to put that into context because indeed Cameroon has not been spared by the virus. Indeed, we are the epicenter in West and Central Africa. As of the 16th of November, we had 22,592 cases with 433 deaths and 21,510 people who were lucky enough to recover from the virus. Now, according to the Public Health Emergency Operations Center, it is interesting to note that more men than women are being affected by the virus. However, women are more exposed to the virus due to being the main caregivers for children, the elderly, and people who are ill, and owing to their being the vast majority of healthcare workers. Next slide, please. Right. So in order to engage government on the socioeconomic impact of COVID-19 on the most vulnerable groups and the poor communities in our society, I thought it was important to first of all know what, how it was that government approached the planning and crisis management around COVID-19. And so what we found was that we could identify two types of considerations, namely clinical governance considerations on the one hand, and on the other hand, socioeconomic governance considerations. Now, in terms of clinical governance, policymakers' preference was shown for having region-specific COVID-19 maps and analysis, whilst national experts' recommendations included assessment of vulnerability. Assessment of vulnerability for COVID-19 by region in Cameroon, useful to guide further research. So even at this stage, you can already see that despite the planning that was ongoing, there was a recognition of the fact that we didn't know everything about how to plan for a crisis of this magnitude in Cameroon. So further research was one of the recommendations from national experts. The other recommendation was that there needed to be an assessment of differences in epidemiological risk factors for COVID-19 and access to healthcare in Cameroon, as this could be useful to identify particular regions at risk, as well as potential mismatches between cases and resource availability. And you can see there that this is quite important for knowing where resources need to be directed to the most, so that the most vulnerable in our society are cared for. Next slide, please. Now, in terms of going back to the COVID-19 clinical governance methodology, it is also interesting to note that two indices were developed. So one for regional vulnerability for severity of COVID-19, and the other for healthcare access in Cameroon. So in terms of the epidemiological vulnerability index, this was designed around 14 indicators, selected based on prior potential association with increased risk of COVID-19. This is all very technical language, but I'm guessing it means that if someone had, was in close proximity to someone who had contracted the virus, that would make them a priority case as far as government, the government methodology was concerned. Now, we had indicators also consisting of the regional weighted percentage of males or females aged 15 to 49 who had a history of diabetes, hyperglycemia, heart disease, hypertension, lung disease, smoking, HIV/AIDS, or malignancy. Now, what is interesting to note here is that, I mean, obviously anyone below the age of 15 and anyone over the age of 49 is not accounted for in this methodology. So that is quite problematic. And the other problematic thing that we found was that the indicators were obtained from the Cameroon 2018 demographic health survey. So it is not, I mean, the data on which the methodology for managing the crisis is based is not as accurate as it could possibly be. Next slide, please. Thank you. So now this is where the discussions starts to be interesting for us in the context of this presentation. The COVID-19 socioeconomic governance methodology. So there were 2 gender-based indicators identified for the healthcare access vulnerability index. One was the percentage of females who reported they had difficulty accessing healthcare when they were sick because of distance to a health facility. The other was percentage of females who reported difficulty accessing healthcare when they were sick due to any cause, including difficulty obtaining permission, lacking money for treatment, or not wanting to go alone. Even more importantly than that was that the transversal indicator used in this methodology was the percentage of the population in the lowest economic quintile. And we need to be aware of the fact that vulnerable groups in our 2 biggest cities, Yaoundé and Douala, were most at risk of COVID-19 contamination based on epidemiological the epidemiological vulnerability index. Also worth noting is the fact that indicators were selected because of travel time, which we've talked about, which we've already talked about, ability to pay, and economic status. I mean, these indicators were selected because travel time, ability to pay, and economic status strongly influence healthcare access in Cameroon, and there is a very low prevalence of health insurance. Also worth noting is that for all social groups, the East, North, Far North, and Adamawa regions, so 4 of our regions were found to have the highest healthcare access vulnerability indices. Next slide, please. Now, in terms of the socioeconomic impact of COVID-19 on vulnerable groups and poor communities per se, I think a session like this one is simply not long enough to discuss just how affected people have been. So we've talked about a few things which we felt needed to be mentioned, but there are so many more that need to be taken into consideration. So one was the people's limited access to food due to social distancing and confinement. The other one was people on low incomes, for example, those working in the informal sector, which is quite big in Cameroon, and smallholder producers, among so many more, as I just said, finding it difficult to cope with the increase in food prices and the instability and in the availability of food and food supplies. We had, for example, petty traders in Cameroon, they are called Bayam Selam, finding it difficult to pay taxes. We have internally displaced people, IDPs, from the Northwest and Southwest crises and Far North crises, because these are the 3 regions which are currently affected by
Hello, Yukai.
Conflict. Can you hear me?
Hello?
Hello?
Charlie, well, we can hear you.
Hello, Yukai?
Charlie, we can hear you.
Yeah, okay, sorry. So
continue, Elomo. Charlie, let's allow Elomo to finish her presentation, please.
Sure, thank you. So, so internally displaced people from the northwest, southwest, and far north regions, which have been affected by devastating conflict, and also refugees, all these people facing lack of resources to cover medical bills associated with the pandemic. Because although I mentioned earlier that the treatment was free, we have to
2
be aware of
minutes.
that. You know, there are other associated costs with a pandemic such as this. So the socio-economic impacts of COVID-19 will also have been felt in workers, in food-related sectors, restaurants, hotels, suffering the loss of jobs and income, with direct implications for people access to food security and nutrition. Next slide, please. Next
Please,
slide,
you
please.
have 1 minute to end.
Okay. So, so government took some measures, of which one was to create a solidarity fund to tackle the increasing threat of COVID-19 with contributions from public and private partners, and a 1 billion, a 1 billion franc CFA starting amount. I think I'll move to the next slide because it speaks of, if you could go to the next slide, thank you. Yeah, it speaks of the way forward beyond COVID, and that involves civil society really engaging with national and local budgetary processes. For example, the Civil Society Reference Group on Public Finances Transparency, of which I am a part, is issuing a citizen lenses report addressing the possible long-term impact of COVID on vulnerable groups, poor communities, and key economic sectors. The need to maintain adequate funding for sustainable development and leaving no one behind as a core priority in national and local governance frameworks. The importance of effective data for development management systems and governmental action, monitoring and evaluation to ensure resources are targeted where most needed. And obviously, civil society recommendations are based on the fact that we ourselves have, you know, experienced the fallout, socioeconomic fallout from COVID-19, and have had to make operational adjustments as a result of this pandemic, which included, I mean, some of the things that we've experienced included fewer event participants, need to modify activities format, and more extensive use of technology.